The next category of antibiotics that comes up in the book is a category called the cephalosporins. And these are discussed in the text on page 72. And they are covered in table 5.1 on page 70. Cephalosporins are mostly bactericidal. They also interfere with building a strong bacterial cell wall. We have two different prototypes. One of them is Keflex, which is a pretty common PO drug, and this is cephalexin. Cephalexin is the generic name, and this is found on page 70 on the table. And then we have ceftriaxone, which is Rocephin. That one you're probably familiar with also. Cephalosporins are broad-spectrum antibiotics, and they come in generations. Remember how in chapter 7 we talked about the different generations of the antihistamines? Many of the antibiotics have generations also, and cephalosporins are a very good example. Cephalosporins now have 4 generations. And so with each generation, the scientists have looked at the previous generation, figured out what works, figured out what does not work, and improved it. So we have first generation drugs include Keflex, so that's been around quite a while, all the way up to the 4th generation, which is a drug called Cefepime or Maxipime, which is used for extremely heavy-duty pathogens. Very stubborn infections usually have to be IV. These are very effective against gram-negative organisms, and if you look at the text on page 72, you see a list of pathogens that the cephalosporins are effective against. If you see the memory jogger on page 72, you see that most cephalosporins have the name Ceph with a PH or an F or Kef in their names. Their trade or generic names are both. These are beta-lactam antibiotics like penicillin. That means in their chemical composition, when you look at it, you're going to see what are known as beta-lactam rings. So there's the diagram that shows the chemical formation. You'll see a ring. And so beta-lactam antibiotics work similarly. They are sort of like cousins to each other. And there is a certain amount of allergic crossover. So 10% of people who are allergic to penicillin will also be allergic to cephalosporins. So they say there's a 10% crossover. That becomes less with every generation. And the way doctors handle it really varies. Some doctors, if they're told that they have a patient who is allergic to penicillin, they will just absolutely put the kibosh on giving them cephalosporins either. Others will say, well, let's give it to them, see how they do. So it just varies from person to person. For instance, I told you about my penicillin allergy, but I'm able to take cephalosporins with no problems. GI side effects are your most common side effects with the cephalosporins. You're going to get an upset stomach. Many of the cephalosporins have to be given IM or IV, but many of them, especially the older ones like Keflex, can be taken PO. And generally you can take them with food. Cephalosporins sometimes will give a disulfiram reaction if taken with alcohol. And you remember when we talked about disulfiram, it's taken to discourage people from drinking. And so mixing the cephalosporins with alcohol will also do that, make the patient very sick. Generally speaking, alcohol does not go well with any antibiotic. A lot of people will really, really get sick if they're on an antibiotic, and it just gives them an incentive to stay away from alcohol for that short time. Patient teaching is found on page 70 under nursing implications, and they just talk about some different things you need to remember for each medication. There's a short section in the text, but like everything else, very important that you read. So patient teaching, look at that in the table on page 70. The next category of drug is a category called the tetracyclines, very common antibiotic. They've also been around for quite a while. And we start talking about those on page 73. In the text, they're covered on page 73, and on the table, we have table 5.2 on page 75, and the very top one are the tetracyclines. Tetracycline, just straight tetracycline, is probably our prototype drug, but there are some others we're going to talk about: minocycline, doxycycline, and they all interfere with the ability of the bacteria to use protein, to make the protein and to use it for their function and reproduction. These antibiotics tend to be bacteriostatic, so they don't work quite as quickly to kill the bacteria, but they do make sure that the bacteria is not allowed to prosper and replicate. These tetracyclines are used for both gram-positive and gram-negative pathogens. It's a broad spectrum antibiotic, and it's the drug of choice in the event of certain conditions. Remember, in chapter 13, we talked about Helicobacter pylori that leads to a lot of ulcers, GI ulcers. Well, tetracycline is one of the drugs of choice for H. pylori, and there are others that it works really well too. The most common adverse reaction with tetracyclines are GI upset, and unfortunately, tetracycline should be taken on an empty stomach. So the GI upset is not helped by that. One of the drugs is a drug called minocycline. Minocin, M-I-N-O-C-I-N, is the trade name. And this is a commonly prescribed drug for adolescents with acne, especially that early acne that ends up looking kind of rashy. Very effective for that, but the most common adverse reaction is vertigo. So if a young person or an adult starts minocycline and they notice that they're dizzy and maybe have some nausea and vomiting, it's probably the minocycline and they need to get switched to something else. The tetracyclines are not for pregnant patients or children under 8 years of age. Tetracyclines can cause permanent discoloration of the teeth. And I've got a picture here. This is somebody who took tetracycline, either got it prenatally or in childhood, and you can see that it causes staining of the teeth. This is not just a stain on the enamel that could come off with white strips. This is staining through and through, and you can't get it off no matter what. These patients end up having to have veneers or caps on their teeth because of this. Tetracyclines can cause photosensitivity or sensitivity to light, so patients on tetracyclines need to be very careful about sun exposure. They can get very sunburned in a shorter amount of time. Like I said, this drug should be given on an empty stomach, and you want to strictly avoid dairy 2 hours before or 2 hours after taking the drug, because dairy will interfere with the absorption and you might as well not be taking anything. Also important to emphasize taking all the tetracyclines until they are gone, because in most cases, if you leave leftover antibiotics in your medicine chest, they're just going to get old and become less effective. Tetracyclines are dangerous because as they expire, they break down into chemicals that will cause nephrotoxicity. They can damage the kidneys. So nobody wants to take an expired tetracycline. And this one I just thought was funny. We have doxycycline. And we're going to talk about doxycycline when we get talking about malaria and some of the other more exotic infections. Although it's pretty good for upper respiratory infections too, especially if you can't take penicillin.